Are we using the microphone? Why not? Let's do it. Let's do it. So I'm going to follow Raj, probably with not as much comedy, but I do speak incredibly fast, and it's a good job because I have definitely overslided myself, so buckle in. So this is me. I've had my NeoGen for, I was trying to work this out the other day, I think probably over maybe about 2 years now, and have been really grateful to have travelled the globe and shared some of our case studies and publications, and it's been a lot of fun, so long may that continue. So I wanted to first start off by kind of just telling you a little bit of a story. There she goes with the story when she's time pending, but I'll be brief. Recently, I was on a medical board meeting. We were looking at redesigning the acne protocols for another device. And there were gentlemen and professionals from all over the globe, from different diversities, different disciplines, which was really good because you got to bash out some really good ideas. And one concept kind of came about that there was a portion of the board who were nervous about going too gung-ho with the policies, with the protocols, because of the risk of problems. Essentially, in this case, it was pigmentation. But then the other side were arguing, but then it's not going to do anything. And it got me thinking that there is this concept, I think, of getting the balance right between providing a treatment that's actually going to be hitting the nail on the head and, you know, providing your patients with what you said, but also mitigating that risk. So I think we've got to make clinical judgments sometimes and use the tools that are available to us so we can, you know, do these treatments, but do them effectively. And I think that's why now, after 2 years, combining NeoGen with so many other avenues is a real key thing. I very rarely deliver NeoGen in isolation. Now, I know we've got an incredible talk later on about acne scarring, so I'm not going to spend too much time on that, but I am going to kind of overview these two things, acne scarring and treating higher Fitzpatrick's, but I'm going to link it to the term exosomes. Now, disclaimer. This is not an exosomes discussion, and I'm not going to do a controversial talk about whether we like them or not. This is simply one of many reasons and many ways in which I combine the NeoGen. So here we go. So first things first, I want to kind of discuss two terms that we see thrown about, exosomes and secretomes. And I promise I'm not going to bore you to death, but I think it's important to kind of understand. I think a lot of the time, our knowledge of products that we use tends to be manufacturer-led, and sometimes a lot of people kind of stop there, and we have to kind of sometimes do a little bit more of a deeper dive. And I think it plays relevance when we're trying to link it to the reason and the rationale for incorporating it. So when we look at the stem cell, we're looking at the secretomes. And essentially the point of this diagram is to just explain that we've got the two fractions. We've got the vesicular and the soluble. And from that, we can break that down further into proteins, cytokines, DNA, and on the flip side, obviously exosomes. Feel free, anyone who wants this afterwards, I'm more than happy to put it on the chat, so feel free. And also a very long-winded reference list. I never like to say something unless I can back it up. Okay, so first of all, looking at the secretome. So quick rehash. This is referring to the full collection of substances that are secreted into that extracellular environment. They're not just exosomes, but we're looking at the proteins, extracellular vesicles, growth factors, and other signaling factors. And essentially, exosomes are a component of that secretome. So they're serving as a carrier to transport a variety of these molecules between cells, facilitating that communication and those biological processes. Now, what do we talk about? We talk about secretomes in terms of their promotion of proliferation and migratory various types of skin cells. So in short, the fibroblasts, the keratinocytes, and the endothelial cells. So looking at that regeneration that we promise our patients. And finally, the range of functions in terms of being anti-inflammatory, antioxidant, antifibrotic, antibacterial, and neuroprotective. But let's focus on the exosome, because essentially that's the term that we see thrown around. So what is it? Well, essentially it's a carrier. They are essential for passing cargo between cells and regulating homeostasis. They're a lipid bilayer membrane. The cargo that contains essential functions for cells, so this is essentially your peptides, your growth factors, cytokines, like I mentioned before. They lack a nucleus. They circulate through those body fluids, and they can transfer information not only to the local cells, but to distant cells as well. And that's kind of where we're linking it up now. So what mechanisms, when we talk about exosomes, can we link in terms of rationalizing why we incorporate it with the NeoGen? Okay, so the first thing I want to talk about is the attenuation of oxidative stress. Now, we know that plasma induces that reactive oxygen species, and it can trigger it. We know that. We've got two roles that we need to do. We've got an oxidative injury, and we've got prolonged inflammation. So why? And obviously, those can both lead to post-inflammatory hyperpigmentation. So essentially, exosomes claim that they can counteract this process by exhibiting intrinsic antioxidant properties, delivering cargo molecules such as catalase and glutathione pyridoxase, and the miRNAs can modulate oxidative stress pathways. And then this is kind of the main one, and the reason why I use it mostly is that melanocyte modulation. So when we've got that skin injury, we're looking at a release of those inflammatory cytokines. These cytokines upregulate the melanogenesis, tongue twister, via the signaling in the melanocytes. And what is the impact then of the exosome? Well, simply they inhibit that melanin synthesis. And the main point is they modulate that pigmentary response after that inflammation. And the final one is the accelerated wound healing. For one of the other companies that I'm a key opinion leader for is Dermalux, and we talk often about the use of Dermalux when we are modulating inflammatory stages. I've spent the last 3 years working on our post-surgical protocols and delivering them across the globe. And one of the things that we continuously get asked is about that inflammatory stage. Yes, we need to go through it, but we need to modulate it. We don't want to be in that stage for much longer. So having that period and knowing that we can take our patients through it and we can get out the other side, so we can, we can reduce the risk that can come from an extended inflammatory period is really important. So we're going to get that accelerated wound healing, reducing that inflammatory duration. And essentially, what's the role? They're going to support that fibroblast activity, facilitate matrix remodeling, and promote that reepithelialization. Get my words out. But essentially, they're going to help our patients expedite that recovery and downtime, which, let's be fair, patients now want to have great treatments, but they don't want downtime, and also enhance the results further, which is giving us that synergistic benefit. So I'm going to share with you 2 case studies. There are a hell of a lot more, and I'm really excited to share with you a big, wide variety tomorrow. So anyone who is there tomorrow, we can do a bit of a deep dive into some various other pathologies and also some of our surgical patients, which is exciting. But the first one I wanted to share with you is an acne scarring patient. Now, I presented this at IMCAS Paris last year, and it was really a good one to present, especially in a room of people who love laser, because we got into a really good debate, which was great. But it was, I can only speak from sharing this case and the facts of it. This gentleman had come to see me. He'd spent literally thousands on various laser treatments over the years. He'd had significant acne as a youngster and was left with really heavy fibrotic tissue. And it was, as you'll see, it was causing problems. This is the picture, by the way, after he'd gone through all these cycles. So he'd had CO2 and various other lasers over the years. And I think he'd had some subcision as well and various things like that. So I'm not going to spend a lot of time on this because I'm very aware that we've got a great talk on scarring tomorrow. But the point of it, and feel free to take a picture, is just, I think sometimes it's important to understand why we get it and also to understand, therefore, how we're going to treat it effectively. But the point is, With the scarring for this gentleman, we also had excessive pigmentation that he had from before. So when I was looking to treat him, I wanted to treat him on a higher level. I was obviously cautious about the fact that we already had that hyperpigmentation. I didn't want to exacerbate that anymore, but I really needed to penetrate a little bit deeper because I needed to break down that fibrotic tissue. What was the logic for combining the two? So obviously the NeoGen plasma delivers that thermal energy to the epidermis, creating that controlled microdamage, which is going to stimulate that wound healing. The exosomes are going to essentially help to promote that tissue repair, and the NeoGen induces that neocollagenesis and can I get my words out today? Neoelastinogenesis, improving the appearance of those atrophic scars, both inducing those type 1 and type 3 collagen productions, improving the skin texture and reducing skin depth, which was important, scar depth, sorry, which was really important for this gentleman. We want the NeoGen to trigger that fibroblast proliferation, enhancing the ECM, producing that, helping with that skin permeability and allowing that deeper exosome penetration. One of the things I love about NeoGen is the fact that I can combine it because of the permeability of the tissue immediately after completing a treatment. It allows me to use a lot of topicals immediately after, knowing that it's going to penetrate where we want it to. And finally, with the anti-inflammatory action, they modulate the cytokines to reduce persistent post-inflammatory responses, which, as we know, can impact the scarring as well. So this was his picture before and after. So we did 3 treatments, 1.8 joules, 2 passes. And we could have gone higher, to be fair, but he was a wuss, so we couldn't. But one thing we did do is immediately after we used, I think, from memory, 1.5 mils of the Purazones, which is what we applied topically. And then I gave him 3 mils of Purazones to take home with him and asked him to the next day put some more on in the morning and again that evening. And then after that, he just continued with his normal aftercare. But what we could see, his main goal was just to make sure that his skin didn't have that. He referred to it as it's pitted. I hate it, it's pitted. And every time he went away, he was conscious of it because he said that his skin would tan unevenly. There I obviously educated him on the use of SPF, obviously. But the point was, what I always love about the NeoGen is not only we were able to break down that fibrosis, improve the skin texture, which you could see. I mean, we scanned him, obviously, you've got the numbers there, but visually it was enough to see. And you could feel, like, literally after his first session, you could feel the difference in his skin texture. But also, as a secondary point to that, he got the rejuvenation element to it as well. He got a much sharper jawline, his neck tightened up, his eye area, improved brow position. So even by default, we got these aesthetic benefits that he wasn't expecting. And for those who ask, his downtime wasn't bad at all. I think by day, I primed him, obviously, because the consultation is super important. I said to him, you may well look like a burns victim for a few days, but we've got to go through that. But by day 4, 5, he was absolutely fine. Slight marks on his skin, but nothing that anybody would notice. So even though we did the 2 passes of 1.8, his downtime was really good. Okay, so I'm going to share with you my next patient. So it's really interesting with what Raj says about the Fitzpatrick, and I think there's a point there because we have to stop analysing that. One of the things that I have done, because I treated, again, after having the NeoGen, you do things, you learn from it, you share it, so other people don't have to make that mistake. The process, the cycle resumes. But I treated a patient who was probably a Fitzpatrick 2. We did a relatively low treatment, and she ended up with post-inflammatory hyperpigmentation. And one of the things that we learned from that is we'd actually scanned her for skincare about 6 months before, and you could see, if I'd have bothered, to look at that, you could see how much of that, deep pigmentation or surface pigmentation was hiding in the background. And that was my error. We have these tools, we don't use them. But again, just looking at her skin, how do you respond in the sun, blah, blah, blah. And you learn from that. So now I definitely do that. Point made. But this is one of my Italian patients So she has already got pigmentation. She's had pigmentation from day to day, but if she has any treatment, she's always really cautious because she's had chemical peels in the past at other places, which has caused pigmentation. The point is she's quite susceptible. She's actually a really good friend of mine now. So when I presented her with this option, and I asked her if she would be my case study, she was really willing to do it. I was slightly nervous, but it all went well, so rest assured. So essentially what we're talking about when we talk about PIH is we're referring to the darkening of the skin due to obviously increased melanin production. Patients with higher Fitzpatrick types present unique challenges, as we know, because of their risk of post-inflammatory hyperpigmentation, keloid formation, and the erythema that we see. But again, we see this in other patients, so we can't just use that Fitzpatrick guide as one size fits all. And melanocytes in darker skin are more reactive to trauma and inflammation, so we have to consider that. It limits the suitability of certain resurfacing technologies, such as ablative lasers or medium-depth chemical peels. And as a result, treatment strategies must be carefully chosen. So what did I do? Decided to go quite high energy with NeoGen. Seemed like a sensible decision at the time. But I decided to obviously use exosomes, purosomes in particular. And the reason for that is I wanted to kind of home in on that melanocyte regulation. So in the context of nitrogen plasma, resurfacing post-procedural integration of exosomes can offer those benefits in terms of that inflammatory control, the melanocyte regulation and that tissue repair. Again, with those higher energy treatments, getting them through those stages so they can resume normality is important. At the beginning, when we first started using it and we didn't kind of home in on our aftercare at the time, we were kind of just playing around with what works for us. People delayed that next appointment. You got the phone call, I'm just going to put it back a week. I'm just going to put it back 2 weeks. And we don't get that now. We never get that now. But that's a testament to the fact that we just hadn't, we hadn't homed in on our procedures well enough with our prep and post. One of the things I took from last year's summit from Sean Charles was that the amount of stuff they do in the run-up to their appointment. And that completely changed the way we treat every single one of our patients. Before they start, we have them on electrolytes. We have them on, treatments to really help. Especially if perhaps they're vegan, we might prime them with amino acids. So there's loads of things that we do now, but that was something we didn't even consider. So thank you, Sean Charles, MediSpa, for that insight. It was useful. Okay, so we know that they operate via controlled thermal injury. We've kind of talked about this, and that initiates that cascade of inflammatory and oxidative stress responses, which is crucial to the wound healing and tissue remodeling. However, in melanin-rich skin, this inflammatory response can also inadvertently lead to melanocyte hyperactivation and pigmentary alterations. And the potential for exosomes, say potential, especially those derived from bovine colostrum, is to counteract these risks is supported by emerging evidence. Now, one of the things I will say is when I was looking, because this was the first case, the scarring was published in Aesthetic Medicine, I think in April, and this is due to be published next month. And when I think next month it's in, and when I say my reference list is long, it is so long, because this is such a controversial subject. So I wanted to make sure that everything I said had at least some decent backing, because my decisions are considered. I'm not the kind of person who does things just because a manufacturer says to do it. So when it is published, please feel free to critique that reference list. So what was the treatment? 1.7 joules. When I told Susie, she asked me if I was sure. Yes, Susie, we're doing it. So I did 2 passes of 1.7. Slightly nervous, but we primed this patient. We literally just put her on, we used the Dermalux to prime her. We didn't use anything else, just the Dermalux. We got on some nice electrolytes, got her nice and hydrated so we could get that penetration. And we did the 2 pass on 1.7. She only had 1 treatment, but you can see in the picture we had a good result in terms of lifting existing pigmentation and not causing any more. And she continued after this to have another 2 treatments, and we got some beautiful tightening around her face as well. This image, annoyingly, was literally about 4 or 5 weeks after a treatment. If you'd seen her, because this was about 6 months ago, the results continued to get better as well, which we know we've seen, but I was being mithered to publish this as quick as possible because I'm impatient. So quickly to rehash, what we've seen here was, yes, we've seen the improvement in the pigmentation. We didn't cause any more. We had a reduction in the wrinkles around her eyes, around her mouth, and a lifting and tightening within the skin. And as we continued with the other 2 or 3 treatments as well, I think we did 3 in total, this continued to improve, which is great. So what are my take-home messages? So first and foremost, both of the studies demonstrated the efficacy of combining NeoGen with Purosomes or Exosomes. To say, can I just as a disclaimer, I don't just combine my treatments with Exosomes. This is one of many, and when I do my demonstration later, I'll kind of talk to you about some of the ones that I use as well. But I think it's important to know the benefits and the pluses and minuses of various tools in your belt. NeoGen, obviously, it has that non-ablative thermal approach, facilitating that remodeling whilst preserving the epidermis, and that obviously helps to reduce that risk of complications and pigmentary complications. And finally, that role of Purosomes for us and for these 2 can show us that it gives us that skin repair, expedites that healing, mitigates that oxidative stress, modulates melanocyte activity, and finally helps to enhance the treatment further without causing any problems. And that is me. How did I do for time? Was I all right?